Welcome, 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 welcome. We're so happy to have you here. This is the first of our 2025 series of horse owner educational webinars from the American Association of Equine Practitioners. We call ourselves AAEP. We are very excited to have you here tonight. My name is Karen Pouts. I'm Director of Education for the AAEP, and I'll be your moderator for this session. Now, the American Association of Equine Practitioners is the world's largest professional membership association for equine veterinarians and veterinary students. And there's a good chance that your personal veterinarian is an AAEP member. One of our primary missions is to deliver the latest treatments and research in equine veterinary medicine to our vet members. This mission extends to providing quality information about the health and welfare of the horse to the clients of our member vets. That's why we're here tonight. We really appreciate your commitment to your horse by being here with us tonight. So this webinar is entitled Foaling 101, Essential Preparation and Neonatal Care for Horse Owners. Our panelist experts on this subject are Doctors Chelsea Folmar and Taylor Huffman. And once we get started, I'll let them introduce themselves further. But first, a quick bit of housekeeping. Now, again, you might have heard me say this before we started, but please understand that we're not able to answer questions specific to your individual horses. Save those questions for your personal veterinarian. However, we do hope you take advantage of the interactive nature of the webinar and chime in with your questions and comments using the Q&A and the chat features. And if you don't see those, sometimes you have to wiggle your mouse around on the screen until those buttons show up. Chat is for doing just that, chatting. When you put something in chat, don't expect a response. We're not going, well, I monitor it, but not closely. Q&A is what we monitor for, okay, I can't say that word, monitor. Q&A is what we monitor for specific questions to the panelists. So if you do have those specific questions, put them there. You can go ahead and put them in now. I see that we already have 7 questions in Q&A. Good job, you guys. Can't promise that we can get to all of them tonight, but we will do our best. Now, a quick shout out to Kevin Hinchman. You can't see him on the screen, but he's hanging around being our IT guy in case we have any trouble. And with that, Dr. Folmar, I think I'm going to pass things over to you.
All right. Can everyone see my screen okay?
Yep, looks good.
Awesome. Hi, guys. As Karen said, my name is Dr. Folmar. Let me go to the next slide here. I am currently at Athens, Georgia, so I saw a few people there from Georgia. Shout out to my Georgia people. You guys can feel free to react at the bottom of the screen. Let me know you're out there. I grew up in Pennsylvania, though, and I've spent a lot of time in the Southeast going to Texas A&M. I was in Ocala, Florida, which is one of the best horse capitals of the world. I know there's debates about what all horse capitals are out there. And now I'm lucky enough to be doing an internal medicine residency here in Georgia. So I'll be finishing up with that in July. And I'm really excited to talk to you guys about my favorite time of year, which is foaling season.
And hi, everyone. I'm Dr. Taylor Huffman. I'm a veterinarian up here in Capital District, New York. I'm from Indiana, so shout out to all my Southern Indiana and Midwest people that are out there. Give me some hearts if you're from the Midwest. But I love working on mares and foals, especially this time of year. And I'm just so excited to be here and chatting with you guys. So let's get rolling.
Well, first, we want to give a shout out to the AAEP. They are the reason we're here tonight and we all get to come together. This is a professional organization that is dedicated to equine veterinary medicine. It's comprised of equine veterinarians, technicians, and our industry partners. And our goal is really to improve the health and welfare of the horse. We also work to further the professional development of our members. So those are primarily the veterinarians and technicians, but we also provide resources and leadership for the benefit of the equine industry. To achieve these goals, we focus our efforts on three main categories, and I have those kind of listed there. They have strategic efforts in place to transform equine practice, further recruitment and retention, as well as improving the life of its members. They also provide innovative educational opportunities to their members and the equine community through publications, education, and webinars such as this one. Ultimately, all of these efforts are to help the horse and improve equine welfare. So that brings us to tonight's plan. I hope you guys are as excited as we are to talk about foaling. And we have three big areas we want to focus on. So our first area we're going to discuss is creating a foaling plan. This is going to go over some of the mare care, some of the records you want to have in place, as well as looking into creating a foaling kit and having kind of all the necessities together in one place. We'll also discuss a parturition checklist. This is the exciting part when you're bringing a new life into this world, and we'll go over some key checkpoints that you want to make sure you're hitting in an appropriate time. And finally, we'll wrap up with some adorable baby pictures as we talk about things that your veterinarian will be looking out for and some things that you can help manage on the farm as well.
All right, let's get rolling. So, records, they are important. All the things that you can keep track of, you should keep track of. Things about the mare's history, the more information you have, the better prepared you are going to be. Things you want to know are when she was bred. Has this mare had any foals before? Has she ever had any issues during gestation or in that early neonatal period? And what kind of breeding info? Was she AI'd? Was she live covered? Was she pasture bred? Do we have an exact date or an approximate date? That is going to help us determine our roughly expected foaling date. Our last pregnancy check, that's something that is going to give us knowledge on the appearance of the embryo, the fetus, or the placenta, or all three. And your expected foaling date, that's an important date to know because that's when you're going to be having eyes really closely on that mare. Usually a mare's gestation period is going to be about 11 months, 340 days on average, but it can be between 320 and 360 days for the considered term foals. For donkeys, they actually do have a little bit longer gestation of about 370. So 360 to 380 is considered a donkey's normal gestation length. And just to briefly touch on a question that I saw in the chat for how old is too old for a broodmare, it's really going to depend on the broodmare if she's ever had foals before. The older a mare is without having had foals before, the tougher it is. And the older the mare gets, the tougher it is for her to maintain her body condition and everything else that goes into foaling. So that's something you're going to have to nuance with your own vet to really figure out what's going to work for your particular case. Now, going on for routine care, some of those things, again, vaccines, dental care, and deworming plan. These are all things that you can go over with your regular vet, but some of the main vaccines you're going to need are ones that protect against the flu rhino, and as well as your regular vaccines that your mare would get yearly. Those are given just before foaling, so that way we have a good immune boost for our colostrum that we're going to talk about later. For dental care, that's really important to make sure that we are keeping mama nice and healthy. She's chewing her food appropriately. She's able to digest it appropriately and overall keep her in good health. Deworming, we don't want to deworm in those first 60 days of pregnancy. And most of the time we will pair the deworming right around those 1 to 3 days before you're expecting mama to foal, because that's going to help get those parasites out of her system and minimize the contamination and transmission to baby. So, we're going to talk about nutrition, and this picture right here is a bad thing. That is fescue. You don't want fescue. Avoid it at all costs because it can be infested with a fungus that can cause a lot of different problems in your broodmare. Some of those include a prolonged gestation, so holding the baby and overcooking your baby, abortion or stillbirth, agalactia, which is the lack of milk production, and dystocia or trouble foaling. So you want to make sure that all hay and bedding are fescue-free for any of your brood mares or pregnant mares. And another thing that we want to avoid is over or under conditioning. So we're going to have a couple slides here. This one is obviously a very emaciated horse, a body condition score of 1 out of 9. Obviously, this horse would have trouble, one, getting pregnant and maintaining a pregnancy. So it is definitely not good. But on the contrast side, if you have a super large horse, a body condition score of 8 or 9 out of 9, anything really over 6 out of 9 in a pregnant mare is going to add excess weight and potentially cause issues with gestation and parturition. What you want is an ideal weight of between 5 and 6 out of 9, and you can really work with your vet to make sure that you know what to look for body condition scoring, but you're going to be looking for very specific areas, and most of the mare's weight that she gains during gestation is going to be in the abdomen. And most of that weight and most of the requirements that she's going to have are going to occur in those last 3 months and into lactation. So the first bit of gestation, your mare shouldn't need any extra food unless she's already struggling with her body condition. And then moving on to insurance. For those of you who have insurance, there are some important things that you need to know. The first one is, what does it cover? Does it cover hospitalization? Does it cover surgery? Or is it something like mortality insurance? The other question is, who does it cover? Does it cover your mare? Does it cover your foal? Or does it cover both? And for that foal, does it cover in utero, or does it only kick in after the foal is born? So those are all really important things that you guys need to know, because we as veterinarians, we're not in on your insurance policy. You got to know, and you got to know for us. The other thing that you need to help us with is make sure if your insurance needs anything from the veterinarian, you need to relay that and make sure that we have all the information so that we can be in communication with your insurance if need be. And the last thing when it comes to insurance is know how much it covers and know what amount of money you are willing to invest if something comes up that is not covered by your insurance or that is over the cost of coverage for your insurance. Because the last thing you want to do is be trying to figure out exactly what you can spend in a crisis situation. Last thing on this slide is talking about the Caslix removal. So for anyone who doesn't know what a Caslix suture is, you know what? I'm happy for you. That means probably your mare has some great conformation behind. But for a mare that has less than ideal conformation, and for some breeds of horses, a Caslick is a procedure where we suture together some of the vulva lips to help create a barrier to prevent any uterine contamination during gestation. So usually we'll recommend Caslix removal at the time of pre-foaling vaccines, or at least 2 weeks before your mare is expected to foal, to minimize the possibility of that extra barrier causing an issue when it comes time to foal. One last statement on that. Be sure that you know how to remove a Caslix yourself in the case of an emergency premature foaling or anything like that. You can work with your vet to make sure that you know exactly what to do in that situation. All right, and now we are on to our environmental preparation. So main thing about your environment that you want or need, you need a clean environment. Depending on where you are, biosecurity may or may not be easy to do. The more horses you have, the harder it is. But the main thing is you want to vaccinate your mares and any horses on farm. You want to isolate any new arrivals to the farm, especially keeping them away from any brood mares or new babies. And if you do happen to have a sick foal, You want to separate that sick foal, and you want to avoid using any of the sick pastures or stalls until they have been thoroughly cleaned and disinfected. In selecting an area for foaling, the area needs to be ideally easy to clean and disinfect. Now that can be a stall or a pasture, ideally a smaller pasture. I wouldn't want a horse out on a bunch of acres where I have to go hunt them down and make sure that they're not having an issue. But if you're using a stall, rubber mats are water resistant and really easy to clean. Sealed concrete walls are easier to clean than wood. And UV light in the pasture, just from the sun, is going to be an excellent source for disinfecting the paddocks if it's dry out. For bedding, the typical go-to is going to be straw, just because it is a non-porous material, because the porous materials like shavings or sawdust can harbor bacteria. And downside of sawdust as well is it can also be an aspiration or blockage risk when it comes to the nares and the amount of time a baby spends down napping. Another consideration that you should have for your foaling area is available lighting. Mares like to foal in the dark in a storm, in my experience. Having an area that has decent lighting is going to really be beneficial for you whenever you are trying to evaluate a situation and determine if you need any interference. And back to a question I think I saw earlier that was admitted pre-discussion, stalling versus paddock. Main thing that I'm concerned with is weather and temperature, because babies have a limited reserve of energy. I don't want them to be using up any of that reserves to stay warm or basically stay warm. Because if the mare was to drop a foal out here in my backyard right now, that baby would be at a significant risk to lose that body heat because it is snow and ice covered. If you live in an area where it's more temperate, foaling out in a pasture is fine by me. But if you've got a mare that does not like a stall, I would recommend staying somewhere where it is definitely more temperate all times of the year. So how to clean and disinfect an area? The great thing is a thorough cleaning, even though it's very labor intensive, a thorough cleaning is going to eliminate all but about 10% of your bacteria, and your disinfectants that you can use can help address that remaining 6 to 7% of bacteria and viruses. So the main thing is remove all of that organic material and debris, start at the top of the walls and work your way down, and then spray the surfaces with something like a dilute bleach and rinse after 10 to 15 minutes. And if possible, you can use a phenolic disinfectant and allow that to dry for 24 hours before any horses come in contact with the stall. And our supplies checklist. What do you need to have ready and available leading up to foaling? Number one, your veterinary contact information. Know it. Have it saved in your phone. Have it posted on a wall, visible and easily accessible to anybody who walks in. And have a good relationship with your veterinarians so that you know they are going to be there when you need them. We want to help you. We want to be there for you, but it's hard to be there for you if we don't know you. Making a full watch plan. What is the plan? Do you have cameras? Do you have a full alert? Do you have someone in the area watching? Or do you have a combination of any of those? And you want to know, with that full watch plan, you want to know what your response time is. If no one is on site, how long does it take you to get there? I would say you want to be 20 minutes or less, ideally, from the start of stage 2 or after the water breaks. Because complications can, anytime that a foaling goes on longer than 30 minutes, that raises some red flags and you may want to get a vet involved. So it's better if you are there before that time. Things that you want to monitor for, monitoring sheet, which we had in our little area for you guys could download. There was a really fun little sheet there, but that can help with monitoring. And you want to monitor for things like udder development, milk or wax on the teats, your mare's comfort level, and loosening of the caudal musculature and the vulva, as well as general signs of impending parturition. And obviously, we want a foaling kit. We're going to touch on what goes into that in a little while, but if you have more than one mare, more than one single mare that is foaling, I would have more than one foaling kit. You never want two mares to go at once and you have a dirty foaling kit. And last but not least, the thing that you need to have is the worst case scenario plan. So it's not a pleasant plan, but you need to decide which individual is the most important to save in case of a dystocia. At minimum, you have to do this. You need to do this prior to that emergency happening, but best is determining that before you even breed your mare, because a common thing I've heard is don't breed something you love dearly, because sometimes we try to get everybody out alive. That is our goal. We always want everyone to walk away. But sometimes we have to make a choice, and sometimes we don't get our wish for anyone coming out. So have a worst case scenario plan.
Awesome. Now, part of trying to get everyone out and as healthy as possible is making sure we're prepared. And this starts with creating a foaling kit. So some things we want to include in that would be a clean tail bandage, as this helps to keep the mare's tail out of the way, helps to keep things as clean as possible. You'll see that's a recurring theme that we have going here. Dr. Huffman talked about it with the foaling area you select. We'll also talk about it a little bit with our foal handling, but again, trying to keep things clean will help set your foal up for success. We also would recommend including an umbilical disinfectant. This can be something like chlorhexidine or betadine. You just want something in there so that when the baby comes out, you're able to clean that navel area, as this can be a site of potential infection and complication. Something that we recommend, but is not always readily available, is a Brix refractometer. So this one's a little weird question, but do we have anyone who likes to do any like homemade wine or beer making in the audience? Any hearts? Well, if you do, or if you have access to Amazon, yeah, I see a heart there. My dad loves doing that as well. A Brix refractometer is a tool that's used to create, or rather to measure sugar content in liquids. So oftentimes used in wine or beer making. But for us, we can actually utilize that to help assess our colostrum quality. And we'll talk in a little bit why that's so important. Some other things that maybe are a little more readily available would be things like clean towels. This can help you just to clean the foal's face and the nostrils. I know that was a question earlier about how you can clean those airways. I think having a good clean towel there so you can kind of wipe everything off can be helpful. You can rub the sides a little bit to stimulate them, and that should help them cough up that airway, or help them cough up anything that's within the airway, rather. The other thing I've sometimes seen is people will use a nasal aspirator, which is kind of like a bulbous looking object, and you can actually put that into the nostrils to help clean them out. You can also use warm water and gentle soap to clean your mare's udder. Again, anything we can do to limit the amount of bacteria that your foal is kind of ingesting or around will help them stay healthy. We talked earlier about using scissors or some other way to open up a calyx. Once you've worked with your vet and kind of understand how to do that, having a pair of scissors on hand is just always helpful. You can also use it to cut something like umbilical tape or even the clamp when you're done with it. I also recommend using gloves. I think this is really important when we have a placenta that you're handling, as there are some things that can have diseases or have bacteria on it that we don't want to be exposed to. Also, if you're handling a sick foal, this is something we can do to try and prevent our bacteria that we have going towards the foal. So it's kind of a two-way street there. And lastly, we'll touch a little bit more about enemas later on, but having an enema on hand is something that you can consider. Now, I hope that you find this list helpful, but I know we're kind of going through things quickly, so we have time for questions here. So I want to just point out that that entire foaling kit is also included on our monitoring sheet. So if you've had a chance to download this, this is something we created especially for tonight. So we'd love your feedback on it. If you like it, let us know. We're happy to adapt it to your needs. But it includes a space for your mare's history. It has a foaling kit checklist that we have. Oh, thanks for the heart, guys. It also includes a parturition review, which we're going to hit on shortly, just some things to watch out for. It has a foaling timing sheet, which when I was an intern back in the day or having our own foals, it was always really helpful because you're so excited to see a baby that sometimes you forget, what time did I see feet? When did the water break? And this gives you a place to write all of that down so you can keep it organized. And then lastly, it includes some diagnostic values that will not only touch on this presentation, but will hopefully help you understand when your vet's talking to you about certain things, kind of what those values mean.
If I could jump in just for a second, because people are asking where they can get that checklist. If you look at the bottom, well, if you're on a regular computer, look at the bottom of your Zoom screen and you'll see a button for resources. Click on resources, then look up at the top. There are 3 tabs: links, documents, and speakers. And in documents, you'll see the AAEP HOEC, which is Horse Owner Education Committee, foaling monitor sheet. And there's also our standard effective equine care guide. So you should be able to download from there. Okay, thank you for letting me interrupt.
Thanks for pointing that out, Karen. We appreciate it. Now we're getting close to that exciting moment, but how do you know when your mare is going to foal? Unfortunately, this is not an exact science, and if it was, I would make millions of dollars being able to tell you. But there are some key things that we can try to the best of our ability to guess when this is going to happen. One of the first noticeable changes is actually to the mammary gland or to the udder. This begins approximately 2 to 6 weeks prior to them reaching full term or to their parturition, which is another word for foaling. And generally, you'll start to see it gradually enlarge. The mammary gland development will be much more pronounced in mares that have had previous foals than in maiden mares. So sometimes I know a few of you said it's your mare's first foal. Sometimes they like to be sneaky and they don't show it as well as some of the older girls. The secretion by the mammary gland changes from a kind of clear straw-colored fluid, and as you get closer, it's going to look more like milk until eventually it becomes almost a yellow golden color, and that's when the colostrum has developed. And generally speaking, that happens in the last day or two right before foaling, so that's another way we can kind of continue to monitor it. Other changes that we can look for as far as milk composition would be actually measuring the calcium concentration or milk pH. These are things often employed by your veterinarian, but if you have pH strips, such as the ones you would use when you're taking care of a pool, you can actually test the milk pH that way and look for that decrease below 6.4, and that can be a sign that foaling is about to start. When we talk about waxing up, which is what's demonstrated in this picture, this refers to kind of a thick, waxy exudate, and that's mainly the dried colostrum that accumulates at the end of the teats. And again, that happens kind of 24 to 48 hours prior to foaling. This is kind of a classic sign that we tell people to look for. And you'll also often hear people say, oh yeah, my mare's waxing up. And this is what they're referring to. Approximately 70% of mares will wax up prior to foaling, and of those, about 70% of them will give birth within the next 24 to 48 hours. But my asterisk, as always, because foals like to keep you on your toes, and that starts with the mares before they even hit the ground, is that this can vary. So sometimes it can happen 1 to 2 weeks before others. So we want to pay close attention if that mare starts dripping milk, as this can be a sign that she's losing some of that really good colostrum before the baby gets here, and that foal may need some extra intervention. Oh, Dr. Huffman, I think you're muted there.
Thanks, Kelsey. Thanks, Dr. Folmar. So moving on to the big event, the stage 1 of parturition, positioning. So like I mentioned earlier, mares are typically nocturnal foalers. That is when they feel the safest to foal. And sometimes I have actually witnessed a mare actively uncomfortable for quite a few hours, but she waited until we all went home and until about midnight until she decided to spit it out. So the first stage of labor in a horse typically will last from 1 to 4 hours. You'll see early signs that resemble colic signs, such as restlessness and pacing, lying down and getting back up repeatedly, looking at their flanks, kicking at their abdomen, sweating, or pawing the ground. And you'll see, you might see the signs ease for a little bit and then resume. That's because during this period, the uterine contractions are moving the foal into the position for delivery. Instead of lying on its back with its legs tucked, it is moving over onto its belly with its legs and head extended, so it is ready to dive on out of the mare's vagina. And as the contractions become stronger, the foal begins to move into the birth canal, and the mare's membranes will rupture, and that release of a large bit of fluid is the water breaking and considered the end of stage 1 and the start of stage 2.
Now, stage 2 is when we're hopeful that things are going to be picking up in action, and this refers to the actual delivery of the foal. The mare's contractions become very powerful during this time. You can actually see her sides kind of heaving down as she's pushing that foal out into the world. She may lay down or remain standing, or sometimes she'll get up, walk around, and go back down, even when you're starting to see legs. This is normal. Don't worry if she's trying to reposition herself. In a normal presentation, the foal's forelegs are extended with one hoof slightly ahead of the other. So as Dr. Huffman said, you're kind of in that diver position coming out, and you should see that the feet or the hooves are actually pointed downward, and that would be normal positioning. As they start coming forward, you'll start to see the head, and this should be stretched out along with the forelegs. As the feet becomes visible through the amnion, and that's the white sac that we have there in the picture, the mare is pushing the foal's shoulders through the cervix. And it's very typical after this that she may take just a small break, as that was a lot of work getting the first half of the foal out. And then generally you'll see her kind of contract a few more times to get the remainder of the foal out. During this time, it's okay if she takes breaks, as the foal is still receiving some oxygen via the umbilical cord. So here in this picture, you can kind of see that sac that the foal was covered in. That's the amnion. And whoever's watching this should be sure that the foal's nose is uncovered and free of fluid. So again, using a towel, you can kind of wipe it off. It's important to go slowly around them, as you don't want to scare the mare. And this is kind of a stressful situation for her, especially if she's a maiden. So just doing small things to help out, but not kind of interfere, is key during this part. This is especially important to clear off those membranes if they haven't ruptured naturally. So you're welcome to kind of go in and pull that off of their face. Again, recommend the use of gloves. And it's very important that the membrane that emerges with the foal should be white in color. So here you can see with our beautiful chestnut baby that you have that nice white sac. If it's not white in appearance, sometimes you'll see this red bag, and this is an emergency. I cannot emphasize enough, if you see this coming out, this is a reason to immediately call your veterinarian. This reddish material is what happens when the placenta has prematurely separated. And during this time, because that placenta isn't functioning as it should, the foal may be deprived of oxygen. So the sooner your veterinarian can get out there to help, the better. It's very normal as the foal is coming out that the hind legs may remain inside the mare for a few minutes as the mare takes another break. This stage can go quickly for some mares, where others can take up to half an hour to complete. Anything over that 30-minute mark is reason for concern. Other things that you'll want to be watching out for is if there's a large amount of vaginal bleeding, or if the mare becomes exhausted and you don't see any progress with the foaling. These are signs that she may be in distress and to call your veterinarian. As Dr. Huffman said, it is very important that this happens in less than 30 minutes, or there's risk that the foal can have complications, or your mare. So being within that 20-minute mark, if you're not seeing a foal or seeing steadily progress being made, I would go ahead and give your veterinarian a call.
All right, and on to our last bit of the foaling process itself. So we want the expulsion of that placenta that's kept baby alive for 11 months. So this is the last stage of labor, and it usually occurs within the first few hours after delivery of the foal. Main thing that is very important is you do not want to pull on the placenta, but you want it to detach on its own from the uterine wall. If your mare is up and moving around, and the placenta is just hanging and hasn't completely released, you can use either cheesecloth or try and tie it up in a bundle so that it doesn't get stepped on. And this also is going to allow the weight of the placenta to pull and create a little bit of traction on the uterine lining and use gravity to help it plop on out. Whoever is there at foaling should examine the placenta once it has passed. It should look like that in a nice, pretty F. And you want to make sure it is complete, because any amount of retained placenta is very likely to cause a uterine infection. It's also wise to hold on to that placenta for whenever your veterinarian comes for a mare and foal check, so that way they can make sure. But especially if you have any concerns that the placenta is not complete, definitely save it for the veterinarian to look at. If there is a long delay in passing the placenta, which is anything greater than 3 hours, you should be calling your veterinarian to examine the mare. And likewise, if a mare has passed the placenta but has severe abdominal discomfort or excessive bleeding after that, you should also call the veterinarian to examine them.
So another kind of emergency situation is what we call a dystocia. And I think you guys have heard us use that phrase once or twice already. This term refers to a difficult birth. And this can occur for a variety of reasons and generally requires a veterinarian, as the wonderful Dr. Patricia Xavier in that picture is demonstrating, to help you get that foal out. If the foal is not presenting in the typical diver position, their malposition can make it harder for them to enter the world. You can have one leg that's been flexed backwards, that's kind of stopping them. Sometimes the whole head can be flexed back, or sometimes you can have what's called a breech delivery, where the foal is actually coming out with its hind legs first, or sometimes even just the hind end. As you can imagine, this makes it much harder on the mare and can require some special positioning and manipulation in order for them to be able to be born. Another thing that can happen is if you have some birth defects or malformation, or sometimes if the mare was bred to a really big stallion, the foal can be too large for it to easily come into this world. To fix this, as I mentioned, a veterinarian can use manual manipulation. Sometimes we're able to do the standing, as in the picture. Other times the mare has to be sedated or anesthetized in order to allow removal. And unfortunately, in some cases, we do recommend going to C-section in order to get that foal out in an appropriate amount of time. Again, that magic number is we try to get it out in less than 30 minutes. As we kind of touched on, there's some key moments there. So if you're not seeing progression in that 30-minute mark, if the mare hasn't passed her placenta in about 3 hours, if there's at any point that you have concerns, our number one recommendation is to call your vet. Having that number handy is going to be hugely helpful. Oh, I think we have a hand raised. Karen, I'm not sure what to do with that.
I would say keep going. If you have a question, put it in the Q&A, everybody, and I'll go ahead and lower that hand. Thank
Perfect.
you.
And if you guys have questions that we don't get to during our presentation, we'll try to leave some extra time. That's why we're going quick through this. That way we can chat at the end. So thank you for your questions. We really appreciate it.
And don't forget to use those reactions. That's very much a help for our panelists to know that you're watching and understanding. And yay, I love the hearts. Hearts are great. Thanks. Okay, Dr. Folmar.
All right, and I'm also doing my best. Sometimes when I'm not talking, I'm popping over to the Q&A to try and type out some answers as well. So I'm sorry if I'm not getting to you. I'm doing the quick ones that I think I can get to as in between. So talking about the 1, 2, 3s of neonates. Hour 1, foals should stand. So they should stand within that first hour after birth. They might be shaky or ungainly, and they're probably gonna hit the dirt a couple times, and they're not likely to succeed on the first go round. Most of the time, your mare is going to encourage them to stand, and you can also assist if needed by scratching on the hindquarters and offering stabilizing support as the foal stands if they need it. You don't want to be the entire lifting force for the foal. You need them to stand on their own, but you can offer a little bit of stability if they need it. Moving on to hour 2. The foal should nurse in hour 2. Just like with standing, a foal attempting to nurse for the first time is an extraordinarily frustrating process to watch. Most of them don't get it on the first go. It's also very important during this time to observe your mare's behavior for any sign of confusion or foal rejection, especially with a maiden mare who has never done this before. She doesn't know what's going on. Something just came out of her. If the mare will not stand for the foal to nurse, but is not kicking at or resentful of the foal in any way, you can have someone hold the mare while encouraging the foal towards her udder by using just some gentle pressure and nudges, and again, scratches on the hindquarters, which is kind of what mom would do by nibbling on their hindquarters as well to nudge them towards her udder. What you don't want to do is try to coax the foal by their head or put them directly next to the udder, as this is going to usually have the opposite effect. Foals are not born halter broke. They don't understand what you're doing up at the head. And we're going to touch on more about how to handle foal rejection later, but suffice to say, if your mare is absolutely rejecting and aggressive towards her new baby, it is time to get your vet involved. Excuse me. All right, hour 3, baby is up. Baby has nursed. And so in doing so, usually that stimulates their GI tract. And so if they haven't passed their first poop beforehand, usually by hour 3, they will pass their meconium. That feces is usually firmer and dark, and sometimes it requires an enema to help the foal pass it. Sometimes it also will get buried in the bedding. So if you don't have constant eyeballs on baby and you're just popping in and doing a couple different checks after they've nursed, make sure you check the bedding. You might find the meconium there. The main thing is, if you are on that hour 3 and you're noticing that no meconium has passed, or again, if your mare has not passed her placenta, that is when you need to call your vet. They will be able to check for any congenital abnormalities, administer an enema, address a retained placenta, or advise on any further steps that might be needed at that time. And this beautiful, beautiful slide is an excellent review of everything that we just talked about. So hour 1, foal stands, hour 2, foal nurses, hour 3, meconium passes, and placenta passes. Everything passes in hour 3. Otherwise, call your vet. The moral of the story: if they don't do things in this time period, get your vet involved, regardless of the time of day or night. Be ready to call and or travel. Foals are time sensitive. Do not wait. And prior proper planning will prevent poor performance. You want to be ready. Have the trailer hooked up. Be ready to go.
Remember that phrase. That's one of Dr. Huffman's many good nuggets of wisdom she's sharing tonight. So it's important that once your foal enters the world and you have a nice, beautiful baby here, that we're able to safely handle it. Now, this may seem like common sense, but as Dr. Huffman said, unfortunately, they are not born halter broken. Not only will handling help you examine the foal, but it'll make it easier for the foal to get used to you being around and hopefully help with training down the road. In general, when working with foals, one of my mottos is kind of less is more. So just like when you're teaching them how to nurse, you don't want to be kind of really manhandling their head. When you're restraining them, it's important to just try very subtle pressure and then gradually increase if they don't respond to it. I really recommend kind of my lesson to students and interns as I'm working with them. You only want to grab firm or bony areas. And the reason we do this is so that you have something steady to hold on to while not causing any damage. So some safe areas to hold on to would include around the neck, like I'm demonstrating this picture. You can kind of go around their hind end. They have a little hip bone right by where my hand is, and sometimes I'll hold on to that because, again, a nice safe area where you kind of have a little built-in handle, if you will. Now, some areas to avoid would be some soft areas. So, reaching around the abdomen, if you press too hard or do too much trauma to that area, you can actually cause a ruptured bladder or some other internal issues, and we want to avoid that. You want to make sure that you're not squeezing really tightly on the rib cage because foals, when they're born, can have rib fractures, and you don't want to cause trauma if there's a rib fracture there by putting too much pressure on it. And then lastly, I recommend staying away from the legs as foals can be really knotty and those legs can be hard to hold on to. So you want to make sure that not only are you not damaging the foal in any way, but they are not damaging you in any way. My other bit of pro tip there, if you can see in the picture, I'm keeping my head away from the foal a little bit. They are notorious for tossing their heads. They like to catch you right here on the chin. So when you're restraining them, keep an eye of where your head is, and also don't have your tongue out while you're talking, or else it's very easy to get your tongue bit. Just a pro tip. And now here's one of my favorite parts of the job is that initial vet assessment. And this is something that I can't emphasize enough. We really strongly recommend performing this at the 12 to 24-hour marks after the foal is born. The reason why is this helps to identify any birth defects and allows veterinarians to go system by system within their body so that we're making sure they have the best possible start to life. A foal absorbs colostrum, which we're so close to giving you all the details about, but they absorb that best within the first 12 hours of life, and their ability to absorb that goes down significantly until about hour 24, where they lose the ability entirely. This is another reason why the exam should be done early, as it can help us determine if they need additional colostrum or sometimes even further intervention. During this check, we will measure IgG levels, which is a specific antibody that they receive from the Mare's colostrum, and it allows us to get an assessment of their immune function. We'll also evaluate the placenta, which hopefully you've been able to save for us. I always like to recommend keeping a trash bag nearby because you can put the placenta in that, tie it up, keeps it moist, and it keeps it away from contaminating anything else. And when we look for signs of placentitis, which can be a discoloration of the placenta, it gives us kind of a little insight into your foal's health while they're in utero or in the mare. But it can also make sure that that placenta is complete so that we make sure the mare gets any assistance she may need if she has a retained placenta. As I mentioned, we'll be going body system by body system to make sure that we have a complete exam of your foal. And that way we have some things that we can look out for. And then also, as we talk about some common foal issues, we have some ideas of things that you guys can look out for. So when you're caring for your foal, you can kind of catch some early red flags if there are any. Depending on how the foal looks during this exam, your veterinarian is able to perform any additional blood work to assess for things like inflammation or assess specific body system function. And one thing I always try to recommend, if you guys, any moms out there, you understand while the baby is very important, we need to make sure they're taken care of. Mom needs some love as well. So it's really important as veterinarians that we have a chance to look at the mare, do a physical exam, and make sure that she's feeling good too. And now the long-awaited colostrum talk. Colostrum is a term that refers to the first milk that is produced by the dam. A good quality colostrum is often thick and kind of golden in color. We like to joke that it's liquid gold, and in this case, it really is. It is so important because the way that the foal's placenta is, they do not get any transfer of immunity while they're in utero, or again, that means in the mare. In order for them to really build up an immune response, the colostrum contains those antibodies that the foal will use to fight off infections. So making sure they get enough colostrum and that it's high quality is very important. This is also one of the reasons why it's important to vaccinate your mares according to your veterinarian's recommendation, which is normally kind of 4 to 6 weeks before the due date, as this will allow your mare to produce antibodies that then goes into the colostrum and then goes into your foal. Now, how can we assess that the foal has had good colostrum? Well, one thing is using that Brix refractometer. We can see how high quality is the colostrum that they're receiving. Another thing we can do is we can actually draw blood work at that initial full assessment and use these kind of snap tests or stall side tests that are pictured here to measure a specific antibody. And that specific antibody is called IgG. And this is just one of the measurements we can use to kind of assess if the foal is going to be able to mount a good immune response to some of the bacteria and things that are in the environment or any infections that they may get later on. These tests help us to assess if there was a failure of passive transfer and if the foal was requiring intervention such as additional colostrum administration, or sometimes we can even use plasma that's been collected from healthy horses in order to transfer antibodies directly into their veins. So again, during this exam, we're able to kind of test these values. And if it's appropriate, oftentimes that means your foal is looking good. It's got enough colostrum. We don't need further intervention. But if it is a failure or partial failure, your veterinarian will be able to help guide you on next steps to give your foal a good start. Oh, you're muted again. You're doing such a good job answering questions. It's hard to go back and forth.
Yep. Thank you so much. I realized it right about the time that you said it. So now we're going to get into some of the common foal concerns, again, pre, dis, and post-mature. So a premature, any of these types of maturity are considered abnormal. You can see them with high-risk pregnancies. Some of that is your older mares or mares that have had trouble in the past. Most of these are going to require oxygen supplementation and positional support to keep the foal in a good position for them to breathe on their own. And most of the time, these foals are going to have musculoskeletal abnormalities. So a premature foal is going to be a foal born prior to that 320-day mark of normal gestation. They're going to be small. They may have incomplete ossification of the cuboidal bones, which are in the carpus. They might have general muscle weakness, joint and tendon laxity, a domed forehead, and floppy ears. A dismature foal is going to be born in the normal time frame, but they are going to have a similar presentation to a premature foal. They just didn't develop appropriately, even though they've been cooking for the right amount of time. They didn't get done. And then you have your post-mature foals that are overcooked. So those are the ones that are born after your typical gestation length. They'll usually have a normal axial skeleton, but they might be thin or emaciated from not getting enough nutritional support from the placenta to support their new size. Usually they are healthy foals that are being retained because there's an inappropriate signal there's a signal not being sent to mom that, hey, baby's ready to come out yet now. The timer on the oven hasn't gone off, for lack of a better analogy. And the longer the foal is retained, the more abnormal they're going to be. And remember when I said fescue was bad? This is one of the reasons why. This is often associated and commonly associated with fescue toxicosis. No fescue. No fescue, please. Thank you. Basically, all of these forms are going to require a full examination, laboratory and diagnostic analyses. And most of the time, they're going to need that oxygen supplementation and positional support that is going to be best served in a hospitalization setting where you've got around-the-clock care for these kiddos.
So another situation that can often require some pretty intensive management is called neonatal maladjustment syndrome. Now, can I get some thumbs up if anyone has ever heard of this or a dummy foal? It has a ton of different names. So we've got perinatal asphyxiation. Oh yeah, good job, guys. Neonatal encephalopathy, hypoxic ischemic encephalopathy. If you Google this, I think there's a list of about 20 things that vets use to refer to it, but it all refers to the same thing, and that is neurologic abnormalities that the foal is experiencing because they came into the world, but as the name suggests, they weren't quite adjusted to it. Initially, these foals can appear normal, which I think is One of the most frustrating things that I have to deal with clients is because we believe you. This foal came into the world, it did all of the right things, and then within a few hours, it starts showing abnormalities that are often subtle at first. So sometimes they may be confused, or maybe they're just kind of standing off by themselves. They suddenly become a little bit weak, and oftentimes they can even become hypothermic, or they stop nursing entirely. These cases, as I mentioned, require intensive management. But the good news is that about 80% of these foals are reported to survive in a referral hospital situation. So, although it can be a big time commitment and financial commitment, most of them do not have any long term neurologic deficits. So, sometimes, as difficult as these cases can be, they can often be very rewarding as well. And one thing that we do have an option of doing that was a lot of research done at UC Davis, although it's not always a quick fix, something we can add in is called the Madigan squeeze technique. And essentially, we have ropes that are attached at very specific places. Again, we don't want to cause any damage to the foals, but this cool procedure actually squeezes the foal and it replicates the birthing process to help create those signals from the brain to say, it's time to adjust, it's time to come into the world. And I've seen some really cool responses to this.
All right, on to sepsis. So, hopefully none of you have had to deal with sepsis, but if any of you had, you know it's not a fun time. So the risk factors, any babies that are going to be predisposed to this are ones that have had a failure of passive transfer with low IgG scores, a dystocia or any abnormality concerning the birth, any maternal illness that may have been passed along via the placenta, and any abnormality that ends up happening with your baby. The most common culprit is the umbilicus. That is a giant entryway for badness if it is not kept clean and dry. But you can also see sepsis emerging from issues with the GI tract, respiratory tract, or any wound or joint infection that takes hold. Most of the symptoms is going to be a foal that is less active. Typically, healthy foals are little brats. They will throw their weight around, and if you've got one that is less active, lethargic, or depressed, that's one of the red flags that you should be watching for. You also might see anorexia or inappetence. Always be on guard with your mare's udder. Check it to make sure it's not super distended or has milk streaming constantly. And look for any sort of dried milk on a baby's face. That can sometimes be an indication that they are not actually latching on and are just bumping around on the udder and getting milk on their face. Other signs would be swollen joints or lameness, because anything with sepsis is basically a widespread body infection, which is why it's such a rough thing to deal with. Things you can do to help prevent sepsis is one, early detection and an early detection of failure of passive transfer and appropriately mitigating that. Make sure that you have a healthy and appropriately conditioned dam, so that way, hopefully, birth goes well. Make sure you have that clean environment. And definitely you want to have quick intervention, plus or minus hospitalization if it's indicated after a difficult birth. Other things you can do is minimize contact between new babies and any other horses, especially in that first 1 to 2 weeks of life, when their umbilicus is drying out and they're finding their feet. And anyone who's handling these new babies, clean clothes, clean shoes, clean hands, or a general PPE, personal protective equipment like gloves and anything like that. Those are all great ways to help minimize any contamination brought from one foal to another or another horse to a foal. Treating this, antibiotics are going to be one of the first go-tos, and usually if we are at a point of sepsis, these babies are most likely going to need hospitalization because they're going to need most likely IV fluid support in terms of LRS plasma, which is the best thing that you can give for a IV fluid for a baby. They might also need nutritional support via a feeding tube, and then any individual treatments based on the body systems that are actually affected at the time.
So next we have a pretty interesting one. So this is neonatal isoerythrolysis, or NI, which is much easier to say. The clinical signs I want you to watch out for this is a yellow mucous membrane. So if you look at kind of the sclera, which is right around the eye, or if you're looking at their oral cavity, you can see they look highlighter yellow. This is due to anemia. So when your veterinarian is checking blood work, they'll see that the red blood cells in the body are lower than normal. Oftentimes, because they don't have enough red blood cells circulating, they're not getting quite as much oxygen. These foals can be kind of lethargic. They can have an increased pulse and respiration rate as they try to compensate for the lack of red blood cells. Treatment for this is normally supportive care. So occasionally they'll need some nutritional support, especially if they don't have the energy to nurse appropriately. Sometimes, if it's bad enough, they can even need a blood transfusion. Now, how does this happen? That's a pretty key point. We want to understand where this disease comes from. I saw that we had a few people who did donkeys in the audience. This is something to be aware of for them as well, because donkeys actually have a special blood antigen or blood type that they have. So some of our mule foals or mule babies are also at risk for this. Essentially, you'll have a mare and a stallion that are different blood types, and there's blood testing that you can actually do in horses to find out what blood type they are. When the mare is bred with the stallion, the mare produces antibodies against the stallion's red blood cells. And this can happen due to just exposure in utero with the foal, or sometimes due to trauma during the breeding. Then, after that mare has already been bred and foaled once, that mare is bred to the same stallion again. That foal receives antibodies from the mare in colostrum that's already said, hey, I recognize this as an antigen, which basically means this is something abnormal that I should attack. But that foal has inherited the antibodies from his dad. So when he receives colostrum from the mare, those antibodies actually attack and destroy those foal's red blood cells that he inherited from his father. So this is a really important thing because it's an immune mediated disease and can be difficult to treat if it's not quickly recognized. So again, highlighter yellow is abnormal in a foal. Some other things we can keep an eye on, kind of switching body systems, is our musculoskeletal system. So as you can see, this foal has a lot going on, the poor guy. And this is what we would consider more of a congenital issue. And that's when the foal is born with that condition. So whether you term this a birth defect or something that, again, it just happens in utero, this can be the result of just gestational length. Unfortunately, it can be idiopathic, which means we don't know the reason. It can be due to certain toxins or diseases. So it's important to get that good history about your mare to your veterinarian so that you can have kind of as much information as possible when treating these. The other type of musculoskeletal abnormality we'll discuss is acquired conditions. And these are conditions that develop after they've been born, but can still need a lot of care to make sure that we're getting their legs as straight as possible, getting their whole system kind of ready to be an adult. So some congenital abnormalities that you can see. If we're talking about the muscular part of the musculoskeletal system would be a myopathy. And this means either inflammation or abnormalities within the muscles themselves. So we have listed here some diseases. If we have any quarter horse or warm blood people, these have been seen kind of in a variety of those species. So HYPP is one that we have genetic testing for. We also have genetic testing for some types of our polysaccharide storage myopathy. Oh yeah, heart's over there. I've got a quarter horse myself, so I understand that. And then we also have some other, depending on what breed you have, some different genetic tests that we can do to try and roll these out. You can also see some spine abnormalities, and malformations in the spine often cause abnormal posturing. So it's important to watch how the foal moves. And again, your veterinarian will do really thorough palpations so they can try to assess and catch those early on. You can even have dwarfism. So if anyone has any minis out there, and this is something that unfortunately we see more commonly in them, but has also been reported in Shetland ponies and Friesians. And essentially, they can come from a lack of growth hormone or sometimes even a thyroid abnormality. So, one thing when we're talking nutrition, I try to caution people on a little bit is too much iodine supplementation. So, some of the supplements that have a lot of like algae or kelp in it can have a lot of iodine and actually cause some thyroid issues. So, keep an eye on what you're supplementing your mares with. And then the last thing, which this little foal is demonstrating partially of, is a cleft palate. And we'll have some pictures of what that looks like down the road. But essentially, this can interfere with their ability to nurse and put them at risk for pneumonia. When we shift over to some of our acquired conditions, we can have a physitis, which is essentially inflammation of the um, growth plate of the bone. And this can be exacerbated by excessive growth. So if you've got a really big, showy warm blood, if you've got a thoroughbred foal that comes out massive and just keeps getting bigger, these are some ones that we'd worry about with that. You can have soft tissue injury. So the foal in the picture has actually torn part of his ligament and tendons. So you can see that he's kind of dragging and knuckling his feet. And oftentimes these foals can require some stall rest or some additional support to try and help them kind of correct and to heal appropriately. And then the last one that we'll talk about is fractures. So this can happen in a variety of locations. So there's physial, which means, or physial, that it's the growth plate that's been affected, but it can also happen within the long bones themselves. Or sometimes, which isn't listed on here, you can actually have crush artifact if you have a really young foal that doesn't have completely developed bones or those cuboidal bones that we talked about earlier. They can actually crush them if they have too much activity. So again, having the full history and kind of understanding all we can about the foal's birthing process can help us identify these things. But I think an important asterisk for that is that if you have a foal that comes up acutely lame, early intervention can be best, because one of the most common causes of acute lameness in a foal is a septic joint. Now, oftentimes this spreads through the blood system. So this is a foal that may have already been sick. Maybe it had some diarrhea or pneumonia when it was young. This can develop weeks or sometimes even months after that initial sickness. And what's really frustrating is sometimes you can get a septic joint even if the foal does not appear ill. So if you see an acute lameness, this is one of my top rollouts that I have. Some clinical signs you can look for, like I mentioned, is lameness. Sometimes you can actually see the swollen joint. It can be kind of hot or painful to palpation. So running your hands up and down the legs while avoiding getting kicked. Remember, we don't hold on to foals with their limbs, but this can help be a way that you can identify if that foal has any spots that are pretty painful and may need further looking at. If you do have a foal that has a septic joint, one of the mainstays is a joint lavage, which is what's happening in that picture. And essentially, we take sterile fluids and we try to clean out that infection. Some of my surgeons like to say that the solution to pollution is dilution. And that is what we were trying to do there. And then the other part that we'll do is antimicrobial therapy to help them fight off that infection. Oh, thanks for the laughs. I'll pass that on.
All right, so moving on to our flexural and angular limb deformities. One of those that we see fairly commonly is a tendon contracture, which is basically the inability to fully extend the leg. This can be caused by malposition in the uterus, abnormal fetal development, diseases or malnutrition in the mare, and any abrupt changes in feeding leading to rapid growth, particularly in some of our older babies as they're hitting those growth spurts, which Dr. Folmar touched on kind of earlier as well. Treating these guys, if you've got a very mild case or a very early case that you've caught, they can often be managed with limiting exercise, doing either bandages or splints depending on the severity, and possibly doing something like oxytetracycline to help loosen the muscles and get those legs to stretch a bit more. More chronic or severe cases might require surgical intervention, though. On the opposite side of that spectrum is your tendon laxity. So basically, these babies are born with weak flexor tendons, and you can see that in the hyperextension of the fetlock, to the point where in some they might be touching the ground. A little bit of tendon laxity is pretty common in newborn foals, definitely more common in your premature or dysmature foals. And usually it is going to be self-limiting in mild cases with some controlled exercise and limiting the running amok type of deal. More severe cases can be addressed with corrective trimming or shoeing, or a light bandage to help protect any part of the limb that's in contact with the ground. Now, these are some of the most common things we see. I don't know if anyone's ever had a foal with angular limb deformity. If you have, feel free to react. They often will have either a deviation to the outside or the inside of the leg. The term valgus is for a deviation laterally, and the term varus is for a deviation medially. Trying to demonstrate that with my own arms is very difficult, actually. Most commonly, it's going to be your carpus that is affected, but your fetlocks or your tarsus can also be, they're all up for grabs there. The deviation varies in severity, and radiographs are going to help you figure out which joint and exactly how much that joint is involved. And again, just like with our other guys, treatment's going to depend on the severity. Some mild cases are considered normal, like this guy pictured, and he might grow out of that and spontaneously improve. Other cases might need some wedging or splints or casts. And in really bad cases, you might need growth plate disruption via surgery. And this guy, this is a windswept foal. So this is a combination of valgus and varus on both of the hind limbs there. So what you see is that combination that makes it look like the foal is just being blown sideways. Usually it stems from a abnormal position in the uterus, and most of them will spontaneously improve and resolve. Again, same thing as with valgus and varus. Mild cases can be treated with controlled exercise and corrective trimming, and more severe cases might include wedging, cast or splints, and the physial growth plate disruption.
All right, guys. Moving on to a different body system, we have full heat diarrhea. This is a very common thing that can occur. It's normally mild and self-limiting type of diarrhea. So you can see our little foal in the picture has some pasty manure on his hind leg. This was termed full heat because it normally happens around 5 to 15 days after birth. So people used to associate that with the mare coming back into heat after giving birth. However, the actual cause is unknown. And we figured this out because even orphan foals who don't have a mom still get this diarrhea oftentimes. And it was thought to be caused by changes in the GI microflora, but we're still researching and trying to gain more knowledge on that. The important thing to note with full heat diarrhea is that these foals are otherwise healthy. So, as Dr. Huffman said, foals have a lot of energy. These guys should be running around, they should be playing, they should be napping hard in between, and they want to be nursing very well from the mare. So, no other abnormalities are noted in these cases. And this is compared to our foals that have active diarrhea. So foals that have diarrhea that could be either infectious or non-infectious, but oftentimes have systemic effects. Some things to look for with this would be fever, lethargy. Sometimes they're not nursing as well. So again, you might see milk on the face that's dried on because they're just not nursing appropriately. You can see dehydration. So if you guys know how to do a skin tint, essentially you just pinch up a little bit of skin on their neck and look at how long it takes for that to go back down. Foals are naturally a little bit stretchier than adults, so it takes a little longer, but that can be one way that you look for dehydration. You can also look at how sunken in their eyes are. That's another tip. Same thing works in calves if we have any cattle people. But we should also see pink mucous membranes. That's normal, but when they're sick, they can become very pink. We call it hyperemic, where they're almost red, or sometimes they can become very pale. So these are all signs that we monitor for. This diarrhea can have both infectious and non-infectious causes. So some non-infectious causes would be gastroenteropathy secondary to that neonatal maladjustment syndrome. So if they're not adjusted to the world too well, you can actually overwhelm the GI tract if they're nursing too much. Sometimes in a little bit older foals, I've seen sand ingestion where we take a radiograph of their belly and they're just filled with sand that's causing irritation, or sometimes even inappropriate nutrition. So if the mare's getting into something they shouldn't have, or sometimes if it's an orphan foal and we're not mixing things up appropriately, that can result in some non-infectious diarrhea. Some infectious causes, which I would say is a majority of what we see, would be things caused by bacteria like Clostridium species, E. coli, or Salmonella. There's also some viruses that you may hear veterinarians refer to, such as rotavirus or coronavirus. Luckily, not the kind people get. Don't worry about that. And there's also protozoas like Cryptosporidium, but that one people can get. Another reason to make sure you're wearing gloves. Our support of this often includes IV fluids, because as you can see, this poor little creature in the picture is losing a lot of fluids out of its hind end. We can provide them nutritional support, some antimicrobials to try and limit any sepsis that can occur from the GI tract, and we'll also correct any electrolyte abnormalities that they may have. One of our last GI concerns that we'll talk about today is a meconium impaction. So we talked about ideally a foal should start passing that meconium kind of within the 3-hour mark. This can be delayed, which is one of the reasons why we'll talk about the great question of enema or not to enema. But when you see a foal with a meconium impaction, it often results in colic signs. And this can be mild, such as our foal kind of on the top there that's just swishing its tail, showing a little bit of straining. Sometimes, though, they can show more active colic signs. So the foal at the bottom there, you can see, has kind of twisted itself into a pretzel. I have some clients that like to call that cockroaching because they're on their back and kicking up their legs like a little cockroach. So seeing those signs can be evidence that they're experiencing some GI upset. So meconium impaction is one of the most common causes of colic signs, but it's not the only one. So if you notice any colic signs, I recommend reaching out to your veterinarian. Now, if you haven't seen meconium be passed and it's causing a blockage, this may be an opportunity where having a fleet enema on hand can be helpful. This is a human product that's high in magnesium, so I don't recommend giving multiple of these, but doing it very gently so as not to cause any rectal trauma can be an option in these foals. Some other options that veterinarians may recommend or may perform themselves would be a soapy water enema. And this includes some soapy liquid that's warm that helps to kind of lubricate the GI tract and soften things up. And then the last type of enema is performed only by a veterinarian and is kind of our last stitch effort to help things move through. The reason why this one's performed only by veterinarians is the foal has to be heavily sedated in order to perform an acetylcysteine enema.
All right, moving on to another body system, the lungs. So, full pneumonia. There are multiple different ways that they can get infected. One of them being while they're still in utero, via the placenta. If there's any sort of infection, that can start to affect the lungs. It can also be contracted via environmental contamination or inhaled through any of the airborne pathogens like viruses, bacteria, or fungi. Um, the other complication that we see a lot more in foals would be an aspiration pneumonia, aspirating something like milk, their meconium in utero, abnormal amniotic fluid in utero, gastric reflux, or if we are treating them for something with either medications or oil or supplements, there's always the risk of aspiration. So whenever medicating or treating foals, it's something that you need to always be very aware of and be very careful with anything that's going in the mouth. For symptoms, the clinical signs for pneumonia in young foals is often a lot more vague than what we see in our adult horses. They can be as simple as the foal is more restless, or might have slightly blue tinged mucous membranes, or sometimes even bright red mucous membranes. You might see weakness or depression, a little bit of lack of suckle, a fever, and in the more advanced cases, that's when you'll start to see the cough and the nasal discharge. Except for if they have acutely aspirated something, then you might actually see some nasal discharge and coughing, but that's more of a response of the airway trying to get something out as opposed to an infection being in there. Treating pneumonia is again going to involve antibiotics, supportive fluid care, potentially some supplemental oxygen, and positional support if you've got a weak foal to make sure that they are able to expand their chest and use their lungs appropriately. Now, for one of the things that causes some of the aspiration things, that would be the cleft palate that we touched on earlier. So the cleft palate is a congenital defect in the roof of the mouth. That can involve either the soft palate, the hard palate, or a combination of both of them. There's a wide range of severity that you can see, and the more tissue that is affected, the more severe it is. Usually you're going to notice it when the foal is nursing. They might have difficulty nursing, might not be able to swallow, or they might have milk come straight out, come pouring out their nostrils as soon as they're done suckling. That defect is going to put them at that increased risk of developing aspiration pneumonia. And diagnosing this using an oral exam and the clinical signs, plus or minus an endoscopy for some of the less severe cases that are just involving the back of the palate. Those are different ways that you can officially diagnose it. Any of these foals that are affected are going to require extensive nursing care, potentially a feeding tube as well, and antibiotics to mitigate any infections. And surgery is only something that can be attempted in minor cases. So for those foals that have a severe defect, they're usually either going to be euthanized or they will die early in life because they cannot eat without aspirating, more or less.
All right, guys, we're moving on to our urogenital system. I know we're kind of running short on time, so if it's okay with you, if you want to give us some thumbs up to vote, we can go through these last few abnormalities really quickly and then have some time for questions. So thumbs up if that sounds okay. Oh yeah, sweet. Speed round. I hope everyone's ready to take some notes. All right, so this is a hernia. So you can see this foal has an abnormal appearance. A hernia is a defect in the body wall. This happens most commonly in the inguinal area. So if you can see back here between his legs, sometimes it can even go into like the scrotum of a colt. It can be umbilical, or sometimes it can even go through the diaphragm, and that's what separates the abdomen from the chest. Most of these require veterinary intervention. If it's really small, I didn't know I could do that. If it's very small, you may be able to actually reduce it with your hand. So if it's an umbilical hernia, you can each day just apply a little pressure to cause it to go where it should. But in more severe cases, you can actually have intestines that get trapped in there, and that can require surgical intervention to both repair the defect, but also save any bowel that may be trapped in there.
All right, patent urachus. So what is a urachus? A urachus is a temporary structure that exists in utero that connects the bladder of the foal to the placenta to get rid of all of that waste. A patent urachus is when that structure does not close off after foaling. So you're going to see potentially some streaming or dribbling urine from the umbilicus, a moist umbilicus, or some urine scalding on the abdomen. Premature or weak foals or any immunocompromised foal is going to be predisposed, as well as colts are actually as well predisposed, just due to the location of their post-birthing urethra. Treatment is going to be in earlier mild cases, keeping that umbilicus clean and dry, and in more complicated or severe or chronic cases, you're probably going to need to do surgical removal of that urachal remnant along with systemic antibiotics. And then omphalophlebitis, a very fancy way of saying an infected umbilicus. So the most common culprit of why this happens is going to be the patent urachus, but any inability to keep the umbilicus clean and dry is going to predispose them to developing this infection at the umbilical stump. You're going to potentially see swelling, discharge, heat, and pain at the umbilical stump. Best way to prevent it is whenever possible, allow for spontaneous breakage of the umbilical cord when the mare stands. But if necessary, use some gentle traction on the umbilical cord while supporting the foal's abdomen whenever trying to remove it. You can also use clamps or as well, which I believe we touched on earlier. And after the umbilical cord is broken, use a 0.5% Chlorhex or 0.1% iodine solution 2 to 4 times daily until your umbilical stump is dry. So again, treating that, navel dips, antibiotics, maybe surgical intervention. And sometimes the umbilicus won't look as drastic as either of these two pictures. So if there's ever any concern, ultrasound exam can be very helpful to diagnose either issue, even if your umbilicus seems to be completely normal. All right, ruptured bladder. So we touched on this earlier, but what can cause this? Uterine contractions whenever foaling is happening. If the foal has a full bladder, uterine contractions on that full bladder can lead to a rupture. Any abdominal trauma, any prolonged recumbency where they're constantly putting all of their weight on their abdomen, any prematurity, sepsis, cystitis, failure of passive transfer, on and on and on. All the things that could predispose this baby to being a problem. Any of the clinical signs that you're going to see is a completely normal baby at birth, but then their heart rate and the respiratory rate are going to start increasing over the next 24 to 72 hours after the rupture happens. Over time, your abdomen will visibly distend and have that pot belly appearance. And most foals will frequently attempt to urinate, and they might not produce very much urine, or they might be straining. They can sometimes still pass normal urine, but usually there will be some straining involved. Your diagnosis is going to be based off of the history and clinical signs, as well as laboratory testing and ultrasound. And the only treatment for this case is surgery. But thankfully, if you've got a well-stabilized baby, you have excellent outcomes from that surgery.
Now, they say the eyes are the window to the soul. In this case, it is a really good way that we can get insight into what's going on with the baby. So, for congenital abnormalities, these can be defects developed in utero. And one thing that we think about for that would be like a congenital cataract. And it's another body system your vet's going to be taking a look at. The acquired portion really lets me understand what's going on with your foal, because sometimes, although the timing is variable for when it presents, it can be secondary to systemic illness or trauma. So some things I think about, if you look in that top picture, how the eye looks very red, that was actually secondary to sepsis, causing kind of blood vessels to rupture within the eye. You can even see it looking very white or yellow, and that's because of white blood cells infiltrating it. Sometimes foals can have tearing or squinting present, so it's good to look at that when you're checking on them each day. And that can happen if there's been any trauma to the eye, or sometimes foals can get what's called entropion. And what that means is the eyelid actually rolls in slightly and causes an ulcer. So making sure you're keeping an eye on that and doing what we can to keep them hydrated and make sure that we don't see any signs of tearing and squinting can be helpful for these foals.
I keep seeing in the chat that everyone's like, now I'm scared. You guys are starting to give me more things to worry about. Like Karen said, forewarned is forearmed, okay? Prior proper planning prevents poor performance, my guys. So here's one of the bad things that we see. Thankfully not as common as you might think, but orphan foals. Big thing to take away from this. They are difficult. Trying to raise a foal on your own is not an easy or task for the faint of heart. If you've got a foal that has been orphaned in that birth to 8-hour mark where colostrum is important, ideally, if you can get colostrum from mom prior to her dying, that would be ideal, because then you can use that to get that into baby, and they need about 2 to 3 liters in that first 8 hours. If we're not able to get colostrum from mom, you can get donor colostrum in theory. There are some facilities that have colostrum banks, so I would check with your vet and your general area to see what is available for you. If your foal has exceeded 12 hours and is now an orphan, if they had colostrum, great. And if they have good immune transfer, awesome. That's step 1 checked. But if not, you've got plasma that you can give to make them immunocompetent. After that, you've got the nurse mare versus bucket feeding debate. Nurse mare is going to be far less intensive work for you as an owner. Nurse mare is going to help be able to discipline child while also providing sustenance versus the every few hours trying to give baby a bucket meal that you would be responsible for. If you do end up, I know that nurse mares are not available for everyone, and if you do need to go the bucket method, just absolutely, I would get a babysitter, even if it's a goat. Get a babysitter, a little companion for your orphan foal, to help teach them some manners. An older gelding sometimes works, or a small pony that's not going to hurt your baby, but will teach them some manners, is going to make life a lot easier for you. And again, I keep saying this, prior proper planning prevents poor performance. The knowing where and how to get resources now is going to save you valuable time and your sanity if you are faced with an emergency. And now I know some people have asked in the Q&A about foal rejection. I'm not sure if it was in the chat as well, but here's the slide you've been waiting for. So foal rejection, what is it? It's basically anytime the mare and foal bonding, it has been interrupted or doesn't take place. Why does it happen? We don't completely know. It's different for every mare. What is going to cause the rejection, though, is the main things that we can focus on. One thing is fear. The mare, potentially, especially with maiden mares, they don't know what just came out of them. That's a completely new thing. They don't know what to do with that. Discomfort, if their udder is very full and tender, sometimes they just don't want baby back there bumping around on it, trying to figure their life out. And some mares just have absolutely no maternal instincts. What it looks like, it can be anything from your ear pinning and squealing at your foal, your tail swishing and kicking at foal, biting the foal, pushing the foal away, or it could be something as simple as not standing for the foal to nurse. How to address it? Number one, safety first. Humans are the most important, so don't get hurt, but ideally we want everyone to be safe. Mare, foal, and handlers. You want to use physical restraint and distraction as step one. Offer mom some hay or some grain and try to use positive reinforcement if she lets the baby nurse. You can also milk her udder a little bit if she will let you. Again, safety first, because that can sometimes relieve a little bit of pressure. If we haven't gotten colostrum out yet, definitely save all of that so we can use it later if need be. And then if that is not working, if she's still being aggressive towards you and baby, more particularly her baby, because mare attitude towards handlers is that's a completely different story. But if she's being aggressive towards her foal, you need to get your vet involved, because we can work with things like sedation and hormonal manipulation to refacilitate that bond. We love using a little bit of chemical restraint. It keeps everybody safe, and it can help promote all the good feelings. That being said, if we go that route and we're still having an aggressive mare who wants nothing to do with that baby, foster or a nurse mare, and at that point you can treat that foal like the orphan foal we just talked about.
And I think at the end of this, as we talked about, there's a lot of things out there that we can be prepared for, but sometimes you just can't be ready for what's walking through the door, or in this case, coming into the stall. So when in doubt, we just encourage you to have a really good relationship with your veterinarian. We're there 24/7 to be able to help you. So our job is to help you reach your goals, and we want to be able to do that. So if you have any concerns, talk to your vet. And leading into the foaling season, one thing we really want to emphasize with this talk is just be prepared. So this time of year is busy. We recognize that. Whether you are feeling overwhelmed, if it's your first time foaling out mares, or if you're similar to this little cutie in the picture and you're just trying to hide from all the craziness of foaling season, the best thing you can do is just to try and ready yourself for those moments. So update your records, prepare the foaling kit, review the stages of parturition that we have listed on that guide. Establish a good veterinary relationship. And as Dr. Huffman says, make sure that you are aware of what can go wrong and who to call when it does, because
My favorite phrase. Prior proper planning prevents poor performance.
So with that, we have just some concluding thoughts here.
Yeah, foals are time sensitive. Don't wait. Go.
And my thing is have things written down. I don't know about you, but when I have a lack of sleep and I have babies everywhere, I don't even remember my name some days. So it's really important to have good medical records that you can go back for so that when I'm the veterinarian and I'm quizzing you on the phone, you're going to have all the answers. With that, we've included some of our resources here and we're happy to share them. Some of them have already been shared with you. And then we'll open it up to you guys and some questions.
We have a bazillion questions, but I've seen a few kind of running themes. One is about moving the Mare and Foal from straw bedding to sawdust. When can that happen?
Yeah, I can take this one, Dr. Huffman, since you've been typing away while I was screen sharing. So I think that's a really important question that we address. I like to leave them on straw at least for the first few days. So I would say somewhere between day 3 to day 5. I know depending on where you're at, straw can be a little bit more expensive, but this gives me reassurances that the foal is able to get up and down on its own. We start to get out of that window where we're a little less concerned about kind of sepsis and other things taking hold. And as soon as I'm sure that the foal is moving about, not having respiratory issues, some of those concerns we had about the bacteria, the inhalation decrease. I'll never say a foal is out of the woods because they like to surprise us, but I think that would be roughly my time frame. One thing we didn't touch about is after the mare has delivered the foal, I do recommend cleaning out the straw or shavings, whatever you're able to have them on, and just giving them fresh bedding to try and keep it as clean as possible.
Another kind of running question is about worming. Apparently, some people have been told they need to worm almost immediately after the mare foals.
I don't know that I have a good and complete answer. Typically, the reason I go for a little before foaling is because once you give the dewormer, they are shedding parasites in their feces for a little while after that. So my goal is to minimize the amount of parasites that are being shed in the environment, especially if any that didn't quite get completely got are passing out. But really it's going to be location and if you knew when baby was supposed to come or not, it's going to be a lot of situational dependence there.
I think that's a good time to refer back to your vet and kind of have a game plan for. I think anytime within that birthing window, so a few days before to immediately after, we're just trying to minimize that exposure to the environment.
Can you give us a timeline again on fescue hay? When should a mare be pulled off of fescue?
So they, in an ideal world, they should not be on fescue at all. At the absolute minimum, you want them off that fescue at least 3 months prior, and I would still be on guard for any of the complications that we could have with fescue, because like we touched on, fescue can also cause abortions. So even those mares that are in that early gestation are not necessarily 100% safe. So if at all possible, no fescue. If that's not a possibility, I would definitely pull them off 3 months prior to hopefully give you your best shot of minimizing those complications during birth and post and pre and blah blah blah, and directly and immediately after birth.
In the chat, someone asked, what about the strains of fescue that are endophyte free?
If they are endophyte free, then they are fine, in theory.
If you're sure the whole field is
If you
endophyte.
are positive, I am suspicious. I wish I wasn't, but I'm suspicious. I can't help it.
A few questions on how old is too old to get your mare pregnant.
Take this one. So as Dr. Huffman kind of alluded to earlier, it's really dependent on the mare. So we're looking at her body condition score. We're looking at any history of diseases she may have. So sometimes if it's an older mare who's a little overweight, maybe she's at risk for laminitis, having a foal can be an additional stress that can be detrimental to her health, in which case, that age would be a little bit lower compared to a mare that hasn't had any other issues with like arthritis or any limb things that can make her uncomfortable. Looking at it kind of scientifically, horses are kind of in their prime from ages to 5 to 15. Between the ages of 15 and 20, we start seeing that their fertility goes down. You also see an increase in issues with the foals themselves that they have. So I think anytime you have a kind of a late teen to early 20s mare, those are conversations you should be having with your veterinarian. And there are diagnostics that can be done to better assess her fertility and to look at what complications you may be having. So this isn't us saying don't breed older mares. It's just making sure that you know what you're getting into so you can be prepared for complications that can arise.
I think that goes back to our constant insistence that you need to have a good relationship with your own vet, because every single one of these questions, one of the answers is it depends. It may be a geographical thing or a climate thing that your vet is going to understand best. So we are very much into you having a good working relationship with a local vet. And I'll take just a moment to plug an earlier horse owner webinar that we did with Dr. Folmar, thank you very much, on preparing for emergencies. And that link that I keep posting in chat on how to find the on-demand recording of this, if you follow that link, you will also see a link to that video on preparing for emergencies. So, the more prepared, the better. Somebody asked in the Q&A, what's the chance of a mare just having her foal on her own and doing fine?
Pretty good, honestly. The vast, I don't want to say the vast majority, but I feel like most of the foalings that I have actually been a part of, just because they were under my care, they didn't need my help. They were just fine. I was just there as backup.
I think it's important to remember that horses in the wild have been having babies for lots of time before we ever got involved. And I feel like some of the issues that we see is either because of our management or the breeding and changes we've made. So we're not trying to scare you guys. Again, we want to give you tools so that you can better be prepared for these emergencies and help your veterinarian with dealing with these. So although a majority of the cases you see will hopefully be happy and healthy and beautiful babies, this talk is mainly focusing on what to do when that isn't the case.
Let's see, why don't we get to one or two more? There's a question on how to use the Brix refractometer to test quality of the mare's milk.
That is a great question. Sorry, Karen, I didn't mean to cut you off there.
Nope, that's what I want to hear. That was a great question.
So you'll actually just take a small amount of the colostrum, and I wish I had a picture of it, but it basically looks like a long tube, and you look into it. And when you do, there's a screen on there. So when you put your sample on it, there'll be a readout, and it's a percentage of sugar normally. But in this case, we're using it for colostrum quality. And depending on what the readout, what percent it tells you, that will let you know colostrum quality. And if you look at our full monitoring sheet, there's some kind of cutoffs that we use. Less than 15% is generally kind of poor quality or, borderline. When you get 15 to 20, you start getting more adequate. And ideally, we want it 20, 23, even 30 would be ideal.
I saw a question in the chat about size of foaling stall, if a 12 by 10 would be sufficient. I would say yes, as long as you don't have an excessively large mare. For the most part, I like a 12 by 12 for most average size mares, but a 12 by 10 should be adequate if you've got a regular size mare. If you've got a mini, that's more than enough. That's like double what they need. But mostly you just need the area for the mare to lay down and get up comfortably, and for you and potentially one or two other people to be able to move around in that stall.
And ideally, I think if you do have a smaller space, just making sure it stays clean, keeping the bedding refreshed can also be helpful.
And I just
Many
thought,
questions. I'm sorry, Dr. Huffman.
okay, go ahead, Karen.
Your comment is more important than my comment. So
I
you
was
go.
just I was just seeing another question about red bags in general. So like what to do. The main thing is get in touch with your vet. They might tell you to open up and pull the foal because if they are far away, but the main thing is you've got to have communication with your vet and know ideally know how to pull a foal if you are in that situation because I know for me here in New York, we sometimes have mountains in between us and our clients. So I know I'm always happy to talk to people and advise them if I am far away and I need them to be able to do something while I'm on the road.
Okay, let's see. What do we have here? They keep coming in. Okay, you guys, I'm calling it on questions from here on out. Or we could be here for another 5 hours.
Absolutely.
I did see a couple people ask about Foal alert systems. Have you had good luck with those or not?
Yeah, I can take this one. So luckily when I was spending time in like Kentucky and Florida, when there's a lot of babies, you get a lot of full alert systems. And I know there's some different styles out there. In general, I think they're really nice. It does require normally a veterinarian to put it in because most of them are surgically placed. Um, but I think it gives you a little peace of mind. I will say my asterisk with that is they're not 100%. So although we've had really good success with them, sometimes horses just like to surprise you. So I think having some backup plans and some other methods for monitoring can also be really beneficial. I don't know if you have any other thoughts, Dr. Huffman.
I know I've had one literally slip out right under the full alert while I was standing there. I literally watched her slide one right out at 8 a.m. in the morning, like a weirdo. So absolutely, they can slide out under the full alert, and they are not 100%, but I do like them. I think that they're a great tool to use if you've got that availability, in combination with all of the other things like cameras or someone on site.
I know there are some more questions up there, and I'm sorry, everyone, but I think some of those questions got answered during the session anyway, and we are just going to have to call it at some point. So, yes, this session is recorded and it will be posted. You've got to give me a little bit of time to get the video.
We haven't even finished yet, guys. How's it going to be
Now,
posted yet?
now. But while you're waiting for this one to go up, you can be watching the other videos that are at that same link that I've been posting. Or go to AAEP.org, the AAEP website, and search for the horse owner education resources, and you'll find the links to those videos. And so, wow, thank you so much, Dr. Taylor Huffman, Dr. Chelsea Folmar, for giving us so much really good information. Appreciate it so much. Y'all, don't be afraid. Your horse will be fine. But we want you to be ready. It is good to know. And again, if I can push anything on you, it's that having that good relationship with a vet so that you're not calling 27 different people at 2 a.m. trying to find someone who can help you. So get that relationship with a vet, hopefully with a vet who's a member of AAEP, but can't all be, well, they could all be members. But anyway, we won't go there. Tell your vet that if they're not a member of AAEP, they should be. But we are so happy that you joined us tonight. And gosh, we had tons of good questions, tons of good information, tons of resources. This was wonderful. Thank you so much, everybody. And thank you to Kevin Hinchman, who's our IT guy behind the scenes, who I don't think had to do any work for us tonight, but we still love him. So we will be having more horse owner webinars, and you'll see information on those. Keep your eye on social media. We send information to your vets who should share it with you. So we hope to see you all again. All right. And with that, I'm going to hang up, but not for my vets. You guys are going to hold on. But thanks, everybody. Really appreciate it. And we will see you soon. Bye.
Thanks, guys.